Many times, emergency medical services are the first professionals to assist in an accident or a crisis. If you like fast-paced, exciting work, then EMS may be a good fit for you. Let's go inside to the team at Citizens Memorial Hospital.
I was introduced to EMS probably in junior high school. My grandfather had to call for an ambulance. He suffered a hemorrhagic stroke. We lived in a rural part of Southwest Missouri, so we had the ambulance and first responders respond to his home, and then he was ultimately flown by medical helicopter to a regional stroke center. And I could see how the team before the hospital, which is what we call pre-hospital today, really was the lifesavers to get them to the right care at the right time. So my passion in healthcare, and specifically to stay in EMS for 16 years now, is that I see direct help to my community. So I've lived, worked in different aspects in this community, and I can see the direct result of our teams helping this community on the front lines every day.
I feel like it's very rewarding for me to be in EMS and being able to help people in their time of need, a lot of times on the worst day of their life, potentially, while they're experiencing tragedy, as well as being able to work as a team with the other crews around me and my partner on the truck.
I got into EMS when I was interested in doing rescue work out west in Wyoming. The favorite parts of the job for me are no day is the same. Every day is different. We get to work with a lot of different people. We have a pretty big team of people that work here, young people, older people. So every day is different. No scene is the same, no patient's the same.
Pre-hospital services is a large department. We cover both the emergency response and our ambulance, as well as the mobile integrated healthcare program, where we have community paramedics, as well as some nurses that go into the home and work with physicians directly, bridging the gap in healthcare. As well, our department encompasses the health transit services, which is our wheelchair and non-emergency service transportation. Professional qualities we like to see in new hires, long-term staff in EMS. You have to be honest, trustworthy, a self-motivator, and have the willingness to learn something new every single day that you come to work.
Do our truck checks, do handoff report from the other crews, and then be ready to run whatever call may come in at a moment's notice, whether that be helping someone's grandmother that's just a little bit too weak, not feeling well that day, stand up, get to her wheelchair, or again, somebody in that tragic situation on the side of the highway, and all weather conditions, just depends, got to be ready for all of it.
To work on an ambulance in the state of Missouri, most organizations require that EMT certificate. EMT class offered either at local hospitals, CMH offers EMT classes, as well as community colleges, or even some fire departments offer that EMT class. So there are multiple scholarships or grants or sponsorships from different organizations. Every organization is a little bit different. Here at CMH, we have a scholarship program that you can apply for, and there's essay and interview portions of that scholarship application process, but it is available online to get that application in. If awarded that degree or that scholarship, then you would be choosing your program to attend, and that class could be paid for, at least in part, if not in full. Other federal and state grants have been available in the past that some pay after completion, some pay for the class up front. But there's a multitude of ways to get in the door without paying, or at least without completely paying for the class yourself.
But yeah, we have courses here at CMH for EMT, and we have affiliation agreements with Paramedic program as well. For a high school student, my advice would be to do some job shadow time, to get on an ambulance, to see what it's like, or ride with the local fire department. Several of us started as volunteer firemen, and so I highly recommend that. service to your community as a young person in high school. And then take an EMT class to just get a basic foundation for another avenue of service in your community with learning about anatomy and physiology and just some basic first aid stuff that can help anywhere in life. So that's be my recommendation. The EMT course is pretty short. It's about 4 months long, so it's not a long course to take. It's about high school, junior, senior year difficulty of curriculum. So that's what I recommend.
A lot of places like at least 2 years of experience to join school, although that's not universal, as well as school is around 8 months to a year long, plus all of the extra clinical time you have to do throughout different departments in healthcare, including a lot of hours on the ambulance, to then follow through and get your tests completed for your certification.
And then there's always others coming up behind you that you can help train as well. So it's a pretty constant learning environment.
Advanced certifications include critical care paramedic certifications, as well as community paramedics, which we use community paramedics in our mobile integrated health programs to provide gaps in care outside of the hospital setting and outside of the emergency medical service response setting.
So our certifications that we have to maintain are basic life support, which is CPR. Paramedics have extra certifications, advanced cardiac life support, which is how to treat cardiac arrests in the field with some advanced medications and electricity. We have a pediatric advanced life support course, which is how to treat children in severe respiratory cases or cardiac cases. And then we have trauma classes about how to take care of people in specific trauma situations. We have special classes on how to birth difficult births in the field. We have classes on neonatal resuscitation, so how to resuscitate an infant that's born that needs to be resuscitated. We have classes on airway management, cardiac 12-lead interpretation and management of those pathologies. So any of the things that the doctor does in the hospital, we're kind of an extension of a physician in the field. We act under the doctor's orders and direction with the intention of beginning some of those essential treatments in the field and then transitioning smoothly to the hospital.
If you're interested in getting involved in healthcare or EMS specifically, come to our website at citizensmemorial.com. You can see our open positions where you can join our EMS team or the healthcare team overall. You can also see our posted education classes and programs, including the EMT program. And you can see where you can get involved to help your community as well.
And now joining us live from CMH is Jordan Hembry, Director of Emergency Services. Jordan, great to have you at Healthcare Career Day.
Hello, thank you. Thank you for the opportunity to speak with you all today. I just want to highlight a couple of points you've seen in the video. The entry point for emergency medical services is first responder and then EMT class. We offer that EMT class. Most hospitals will offer that EMT class, and colleges, especially junior colleges or community colleges, will offer that class, as well as some fire departments. It's going to be the first entry point into emergency medical services and to come join our team. And then the career path from there will grow. So EMT is a starting point. From there, after a few years of experience, you can move on to advanced EMT and then paramedic certification, and then additional certifications on top of paramedic certifications to do the more critical care transport, including flight medicine or community paramedics that we use as an extender of the physician in the patient home to keep the patient out of the hospital if they don't need it. Also, EMS serves as a great starter point for other healthcare careers. There are bridge classes from paramedic to nursing degree programs, and I have personal friends who went from paramedic to physician assistant programs or even physicians. So there's just a couple of key points I wanted to highlight from our video there. And then I would like to open the floor if there are any questions.
Yes, actually, Jordan, we do have a couple questions coming in today. Right now we have Hannibal High School is interested in answering a few questions. If we have Hannibal on, we'll go ahead and pitch to Hannibal. Good morning, Hannibal High School.
Good morning. What past experiences do you feel have equipped you for this job?
So, as you see in the video, my experience with my family needing emergency medical services showed that the folks that responded, I lived in a small community, the folks who responded were familiar with our family, and they showed us compassion as well as advanced healthcare to take care of my grandfather. So, what equipped me was the compassion to help other people, specifically in my community. In the last 16 years I've been in EMS, I have always worked in and around my home community, helping people that I know outside of work. I go to church with them, went to school with them, just helping my community personally. So just that compassion to help others.
Outstanding, Jordan. We do have some more questions that are coming in right now on the Q&A. One question, Mrs. Shelley's class would like to know what's the most exciting or challenging part of being a paramedic?
There are so many exciting and challenging parts. The exciting thing for me, again, helping my community, seeing someone in the time of need, helping them today, and then seeing them tomorrow back on their feet or back in the workplace, back on the road outside of that emergency medical need. Those are the exciting things to see patients we helped back at work, back in the community, doing the things they love to do.
Excellent. We have another question that came in, Jordan. Abigail asks, what classes would be good to be on the pathway to nursing? I guess if you could get your foot in the door from EMT or paramedic, can you go right into nursing, and what does that look like?
Absolutely. We have several folks that work in EMS while attending nursing school. EMS is a 24/7 job, so we work some 12-hour shifts, 8-hour shifts, and 24-hour shifts. Those people that work 24-hour shifts only work 8 days per month, so it allows them to go to school for nursing, paramedic school, physician assistant, all those things. So to get started in the door, you want to look into your science classes, your biology, your chemistry classes, anatomy if you have that opportunity. Look into those. In high school, if you have the opportunity, just to attend a hands-only CPR class. You will learn life-saving procedure just by attending a 2-minute hands-only CPR class that can get you started.
You know, that's so important, Jordan. Thanks for mentioning that. You know, anybody can really learn how to perform CPR and some other life-saving skills to help a friend in need or somebody in their family at a time of challenge and trouble. So thank you for mentioning it. We can all do better in learning about those type of life-saving skills. I have a couple more questions coming in. Let's see. Marina from North Callaway asks, how much money does an EMT paramedic typically make?
Yeah, so there's a lot of advancement in the field. Starting salary, we like to look at it as a salary-based approach now. So a starting salary for an EMT is around $40,000 a year, and it'll grow from there with experience, depending on how much experience you have coming into the job. The other great aspect is that in order to make that, it's an entry-level position, and many times we can find ways to pay for your education. So you're not paying for your education before starting that entry level, and it opens the door to many healthcare opportunities. And then paramedics typically make a bit more than that because they have more responsibility and more training.
If you work on a medical team that is actually a life flight, if you're on the helicopter, do you get paid a little bit more for that?
Sometimes the helicopters typically employ flight nurses and flight paramedics, so they have a bit more training, and so typically with more training and more certifications comes a higher salary.
Okay. Yeah, I would imagine if you're flying around in a helicopter saving lives, it's got to come with a little bit of extra money. Some more questions came in. Let's see. Smithville High School. Do you get motion sickness while treating patients while in the ambulance? Good question, Smithville.
I've had that experience one time. I love roller coasters, always enjoyed that. We call it surfing in the back while we're taking care of patients sometimes. So I personally have only experienced it one time. Some people do experience that. We have different ways to help cope with that while transporting the ill and injured.
Very good, very good. Surfing in the back. can imagine rocking and rolling trying to save a life as you're going down the highway at 60 miles, 70 miles an hour. So a couple of students asked, how is your job fun? What's fun about your job?
Every aspect. So I do have an office and I see it occasionally throughout the week, but literally my office is our about 600 square miles of coverage area where we spend our time helping our community. So I may drive a couple of hours today going out and responding to other calls and helping folks in the community, in which time I have the opportunity to be outside. I'm not stuck inside all the time. I have the opportunity to see a wide variety of folks and a wide variety of opportunities in different locations as well. So we cover lakes, rivers, farmland, as well as some urban area. And I get to see all of that in the same day.
Wow, yeah, quite an array of different areas that you're going through. So never a dull moment, never a dull day, and you're not sitting in a cubicle all day waiting for the clock.
Exactly.
Jordan, we have a couple more questions, then we're going to have to zoom on out to our next site. One student asked, Key from her class asked, how do you stay calm in an emergency?
As you can see from our video, we focus on education and continuing training. We want to prepare for every situation because we never get to schedule what emergency happens that day. So we have to prepare for everything. We have a long list of continuing education that we complete on a monthly and quarterly basis every year in order to prepare for that, to stay calm in the moment so we can provide care in that emergency.
Great. And one last question, Angela asks, how old do you have to be to start an EMS program?
So typically most employers like to see 18 years old. You can start the EMT class before you turn 18. First responders, you can start even younger than that. And there's no age limit for hands-only CPR, so you can start that now.
Fantastic. So you hear that right now, students. You can get going as soon as you graduate from high school or as soon as you hit 18, whichever comes first. So, well, Jordan, thank you so much for joining us for Healthcare Career Day. We're moving on to our next healthcare provider for the day, but with that, we'd love to say thank you and be safe out there as you help patients get to where they need to be.
Thank you.